There is a particular side effect of many psychiatric drugs in the class that are known as antipsychotics. And this includes, drugs you may have heard of like Seroquel, Zyprexa, Abilify, and as well as some older drugs like Haldol and Prolixin. That is very more difficult to assess, and it really does not respond to treatment with another drug. And it's called akathisia. And I'm going to describe it to you because it could be considered like a form of torture. Because what you experience, and it might be a little bit similar to what lay people know as restless leg syndrome, but it doesn't just occur when you're trying to sleep. And it's a feeling of uneasiness in your body that you can't get your body into a comfortable, neutral position like that. You would have to, imagine like kind of writhing around in your seat, you have wet clothes on and you're super uncomfortable. And no matter what you do, it's just there. You feel uneasy, not right in some way. And they would feel like that all the time. In fact, many times they would misinterpret this experience as a worsening of the mental illness. And many times people would get this side effect when they were prescribed this drug as a sleeping pill by a family doctor, because these drugs are prescribed as sleeping pills more than they're prescribed for actual psychiatric patients. And the primary care doctors have no idea what akathisia is because they're not trained on these drugs, because they don't have any psychiatric training, even though they manage probably 90% of psychiatric issues among the population because they're accessible. Psychiatrists are hard to find in many places. So I've seen people come to the emergency department thinking they're having a psychiatric crisis, but they're just having this side effect. And when you feel this way, you could imagine that you could get quite irritable and lash out. And with patients who have a tendency to be violent and very difficult interpersonally and aggressive, this brings it out in them. And so I think that is a very insidious and dangerous way that some of these drugs can increase the violent tendencies of the patients who are taking them. But I have not seen evidence that someone who is not a violent would be given a psychiatric drug and turn into a violent behaving person.